Assalamualaikum and hi! Welcome to your COVID-19 Vaccine Administration Center. This video will explain regarding the process of getting vaccinated and other important information. Kindly pay attention to smoothen the process. COVID-19 vaccination is very important, mainly because most of us don't want to die from COVID-19. Vaccinations have been proven to prevent the transmission of infectious diseases and helps achieve more than 90% herd immunity. When vaccine programs are fully engaged, it can reduce the cost of health expenses in the long term. Basically, there are 6 steps in the process of getting vaccinated at the center and several steps to be done at home. Step 1. Check personal information, place and schedule of your vaccine administration. Step 2. Check temperature and symptoms. Step 3. Register at the designated counter and scan your QR code. Step 4 is consultation and consent conducted by doctors. If you agree, fill in and sign the consent form. Step 5 is where you are injected, and Step 6 is observation to observe for any allergic reaction or AEFI, lasting 15 to 30 minutes. If there is no reaction during observation, you can go home. Update your status on your app. You will then get an automatic update on your second jab. At home, you may feel unwell. You may take Panadol or paracetamol 2 tabs 3 to 4 times a day. If you're still unwell, immediately go to the hospital. While waiting for the second dose, strict adherence to SOP is warranted. If you're unfortunately infected, your second dose will be delayed to 90 days. Your second dose process is similar to the first dose. When you're done, update your status in MySejahtera. Continue to observe strict adherence to SOPs to avoid infection with other variants. Next is how to fill in the consent form. Read carefully and fill in the COVID-19 vaccination consent form. Mark in the relevant boxes. Fill in your name, IC number, and name of vaccine. Fill in the lower portion but don't sign yet. Leave the witness signature for the doctor. Next is some important information for you to know. After the first dose, your body needs about 2 weeks to develop and activate antibodies. Efficacy is between 50 to 70%. The second dose will take similar time to reinforce and boost efficacy to reach more than 90%. Time interval between the 2 jabs is 21 to 28 days, so strict adherence is important to avoid infection. At the moment, pregnant women, breastfeeding mothers, people who are allergic to vaccines and have history of severe allergies, people with blood clotting problems, severe neurological disorders, uncontrolled chronic conditions, compromised immune system, people taking certain drugs, and people who are not well cannot be vaccinated. If you had COVID-19, you will need to wait roughly about 3 months before being able to be vaccinated. There are 3 groups of people requiring pre-vaccination assessments by their specialists. Number 1 are immunocompromised individuals. Number 2, patients with bleeding tendencies. And number 3, patients with history of severe allergy. In Malaysia, there are many people with hypertension, diabetes, and high cholesterol. If these conditions are well controlled, they are okay to be vaccinated. Inform doctors of your health condition and history of allergic reactions, if any. The vaccine will be injected at your upper arm, roughly about 2 to 3 fingers from the top of your shoulder. Some people have no symptoms and yet others do. Most commonly are pain at injection site and fever. Burning sensation at injection sites, high fever and chills are rare, and even more rare are people with muscle cramps, swelling of eyelids, nosebleeds, and people who have chest pain. If you do develop mild symptoms, you may self-treat with Panadol or paracetamol as mentioned earlier. Do not take any other painkiller as it may cause complications. If you have severe or unresolving symptoms, immediately go to the clinic or hospital. During the observation, if you develop an allergic reaction or an AEFI, immediately notify the healthcare worker on standby. They will then attend to you. Thank you for your cooperation and attention. May we all be protected against COVID-19 and may the pandemic end soon.